Hello there. I'm so glad you're here with me. Today, we're going to take some time to learn something very important, something that could help you or maybe someone you love very much. We're going to learn how to listen to our hearts. You can think of it like learning a special language. It's the language your own heart uses to talk to you. And learning what it's saying? Well, that's a powerful way to keep yourself and the people you care for safe and sound.
So first, let's talk about what happens inside our body when a heart needs help. We'll go through it nice and slow, one step at a time, so it's easy to understand.
I want you to imagine your heart is like a little village, working hard every day. And the blood that flows to it, well, that's like a river that brings food and water to the village. Now, a heart attack is like a big rock falling and blocking that river. When the food and water can't get to the village, it gets into trouble. That's exactly what's happening when the blood can't get to the heart. Doctors have a little saying. They say time is muscle. All that means is the faster we can get that big rock out of the river, the healthier the heart muscle stays. That's why knowing the signs and acting quickly is the most important thing we can do.
So, what are these signs? What warnings does our body send us? Let's look at the most common ones together. These are the ones everyone should know and remember.
The one most people know about is a feeling in the chest. But, it's often not that sharp, sudden pain you might see in the movies. A lot of people say it feels more like a heavy weight is sitting on their chest, or a tight squeezing, or just a strange fullness right in the middle. It's a deep kind of discomfort. And this feeling, it might stay for a while, or it might go away and then come back again. And that feeling, it doesn't always just stay in the chest. Sometimes it decides to travel. You might feel an ache that starts to spread out to your shoulders, or maybe down one of your arms, or even both. Sometimes it goes into your back, or up into your neck and jaw. It's all the same warning, just showing up in a different spot. Here's another really important one. It's feeling like you just can't get enough air, like you can't catch your breath. You could be sitting quietly, not doing a thing, but you feel like you just ran up a big hill. This can happen with the chest feeling, but sometimes it happens all by itself. Your body has other ways of telling you something's wrong, too. You might all of a sudden break out in a cold sweat for no reason at all. Or you could start to feel sick to your stomach, or very dizzy and lightheaded, almost like you might faint. These are all ways your body is trying to say, hey, something isn't right here. Please listen.
Now, it's important to know that sometimes the warnings aren't so loud. Sometimes they're quieter, and sometimes they can be different for a man than for a woman. Let's talk about these softer signs, because they are just as important to hear.
Men often feel that really heavy, crushing chest pain we just talked about, but for women, the signs can be different. A woman might just feel very short of breath or sick to her stomach. She might have pain not in her chest, but in her jaw or her back. And one of the biggest signs for women is a deep, sudden tiredness that just washes over you for no reason. It's so easy to think, oh, I'm just getting the flu, or I ate something funny. That's why it's so important for women to know that these quieter signs can be very serious. You should never, ever brush them aside.
And believe it or not, sometimes a heart attack can be, well, almost completely quiet. This is what's called a silent heart attack. There might be no signs at all, or the feelings are so small that they're easy to miss. This happens more often with older folks and with people who have diabetes. So, why would it be silent? Well, think of it this way. Sometimes a condition like diabetes can damage the body's little messenger pathways, the nerves. If the nerves that are supposed to carry the pain message from the heart get hurt, then the message just never gets delivered. The heart is calling for help, but the brain can't hear the call. Okay, we've learned how to listen for the signs, both loud and quiet. Now we're going to talk about the most important part of our story today, what to do if you hear them. These are simple, calm steps that can truly save a life.
If you even think for a second that someone might be having a heart attack, the very first thing you do is call for help. Don't wait, call right away. Then, while you're waiting for help to come, you can help the person sit down and just rest as calmly as possible. And if the person on the phone tells you to, have them chew one aspirin slowly, but only if they say it's okay.
Here in the United States, that important number is 911. If you live in another country, please take a moment someday to learn your own emergency number. It's so important to know. Calling this number brings people with training who can start helping the second they arrive. Now, knowing what to do is important, but knowing what not to do is just as important. Please, please do not try to drive to the hospital yourself. Let the ambulance come to you. Don't just wait and hope the feeling will go away on its own. And This is a big one. Don't let anybody talk you out of calling for help. It is always, always better to be safe. Let's end our time together on a hopeful note. We've learned how to listen for signs of trouble, but, there are so many simple things we can do every single day to keep our hearts happy and strong so they don't have to call for help in the first place. Taking care of our heart is a lot like taking care of a little garden. It does best with good food, like fresh vegetables and fruits. It likes gentle movement, like taking a nice walk every day. And it needs clean air, so letting go of smoking is one of the kindest things you can ever do for your heart. And just like a garden needs quiet to grow, our hearts need us to find ways to manage our worries, get good sleep, and keep an eye on our blood pressure. It's also a good idea to know your own family story. If heart trouble has happened to others in your family, that's good information to know and to share with your doctor. And visiting your doctor for regular checkups, well, that's just like having a good friend check in to make sure everything is running right. It's all part of being a good friend to your own heart. We learned a very important story together today. Now, just take a quiet moment and think, who in your life needs to hear this story too? Sharing what you've learned is a simple, wonderful way to show you care. Thank you for spending this time with me. Be well and take good care of your heart.